Hey there, everyone, and welcome back to our channel. Today, we're diving into the exciting world of research and testing our knowledge with some seriously challenging questions. If you're a nursing student, a healthcare professional, or just someone interested in the fascinating world of research, you're in the right place. Today, we're going to test your knowledge with some challenging questions related to research. I'll present a question, give you a moment to think about it, and then provide the answer along with a detailed rationale. Remember, the world of research is all about curiosity and discovery. So don't be discouraged if you find these questions tough. We're here to learn and grow together. So grab your thinking caps and let's kick things off with our first challenging research question. Question 1. A nurse is conducting a research study to investigate the effectiveness of a new pain management protocol for post-operative patients. The nurse randomly assigns patients to either the experimental group receiving the new protocol or the control group receiving standard care. Which research design is being used in the study? A cohort study, B case control study, C randomized controlled trial RCT, D cross-sectional study. Answer, C randomized controlled trial RCT. Rationale, a randomized controlled trial RCT is a research design in which participants are randomly assigned to different groups, with one group receiving the experimental treatment new pain management protocol and the other group receiving standard care control group. RCTs are used to assess the effectiveness of interventions and are considered one of the strongest designs for establishing cause and effect relationships. Question 2. A nurse is reviewing a research article and notices that the study reports a high standard deviation for a key outcome variable. What does this high standard deviation indicate? A. The data is precise and reliable. B. The data is normally distributed. C. The data is consistent and free from variability. D. The data is dispersed and variable. Answer, D. The data is dispersed and variable. Rationale. A high standard deviation indicates that the data points in the sample are spread out or dispersed from the mean average. In other words, there is a significant amount of variability in the data. This suggests that the data is not consistent and that individual data points may be far from the mean. A high standard deviation can have implications for the reliability and generalizability of study results. Question 3. A nurse is conducting a research study and wants to ensure that the study's findings can be applied to a larger population. What is the term for this concept in research? A. Reliability. B. Validity. C. Generalizability. D. Precision. Answer, C. Generalizability. Rationale. Generalizability refers to the extent to which the findings of a research study can be applied to a larger population beyond the study sample. It is a measure of how well the results of the study represent the characteristics and behaviors of the broader population. Researchers strive for high generalizability to make their findings relevant and applicable to a wider context. Question 4. A nurse is participating in a research study and is concerned about potential biases that could affect the study's results. What is the term for the type of bias that occurs when participants' knowledge of being in a study influences their behavior? A. Selection bias. B. Observer bias. C. Hawthorne effect. D. Recall bias. Answer, C. Hawthorne effect. Rationale. The Hawthorne effect is a type of bias that occurs when participants alter their behavior because they are aware they are being observed or are part of a study. This can lead to changes in behavior that may not accurately reflect their typical actions, potentially affecting the study's results. Question 5. A nurse is conducting a systematic review of research studies on the effectiveness of various interventions for reducing hospital-acquired infections. What is the primary goal of a systematic review? A. To generate new hypotheses. B. To conduct original research. C. To provide a summary of existing research. D. To determine statistical significance. Answer, C. To provide a summary of existing research. Rationale. The primary goal of a systematic review is to provide a comprehensive and unbiased summary of existing research studies on a specific topic. It involves a rigorous process of identifying selecting, and synthesizing relevant studies to provide an evidence-based overview of the current state of knowledge on the topic. Systematic reviews are valuable for informing clinical practice and policy decisions by synthesizing the best available evidence. Question 6. A nurse is conducting a research study to investigate the effects of a new surgical technique on patient outcomes. Which of the following variables would be considered a dependent variable in this study? A patient age, B. Surgical technique, C. Length of hospital stay, D. Nurse experience. Answer: C. Length of hospital stay. Rationale: the dependent variable is the outcome or response that the researcher is interested in studying and is often affected by the independent variable, in this case, the surgical technique in this study. The length of hospital stay is an outcome that can be influenced by the choice of surgical technique, making it the dependent variable. Question 7. A nurse is conducting a qualitative research study exploring the experiences of parents of children with autism. Which data collection method is most appropriate for this study? A. Surveys with closed-ended questions, B. Observational checklists, C. Semi-structured interviews, D. Randomized controlled trials. Answer: C. Semi-structured interviews. Rationale: semi-structured interviews are a suitable data collection method for qualitative research focused on exploring individuals' experiences, perspectives, and emotions, such as those of parents of children with autism. These interviews allow for open-ended questions and in-depth discussions, facilitating a deeper understanding of the participants' experiences. Question 8. A nurse is conducting a literature review and comes across a systematic review. What is the primary characteristic that distinguishes a systematic review from other types of reviews? It includes only recent research studies. B. It summarizes research studies from a single author. C. It follows a structured and rigorous methodology. D. It focuses on opinion pieces and editorials. Answer: C. It follows a structured and rigorous methodology. Rationale: a systematic review is distinguished by its structured and rigorous methodology. It follows a well-defined process for identifying, selecting, and synthesizing research studies on a specific topic, ensuring transparency and minimizing bias. This makes systematic reviews a reliable source of evidence in healthcare. Question 9. A nurse is conducting a research study and wants to minimize the risk of selection bias. Which sampling method should the nurse use? A. Convenience sampling, B. Snowball sampling, C. Random sampling, D. Purposive sampling. Answer: C. Random sampling. Rationale: random sampling involves selecting participants from the population at random, giving each individual an equal chance of being included in the study. This method helps minimize selection bias, ensuring that the sample is representative of the population and reducing the likelihood of bias in the study results. Question 10. A nurse is reviewing a research article and finds that the study's results are statistically significant with a p-value of 0.03. What does this p-value indicate? A. The study results are statistically significant. B. The study results are not statistically significant. C. The study results are inconclusive. D. The p-value cannot determine statistical significance. Answer: A. The study results are statistically significant. Rationale: a p-value of 0.03 is less than the commonly used significance level of 0.05. This indicates that there is a low probability 3% of obtaining the study results by chance if the null hypothesis were true. When the p-value is less than the significance level, it is considered statistically significant, suggesting that there is evidence to reject the null hypothesis. Question 11. A nurse is conducting a research study and selects a sample size of 30 participants. What is one potential disadvantage of using a small sample size in research? A. Increased cost of the study. B. Difficulty in recruiting participants. C. Reduced statistical power. D. Enhanced generalizability of results. Answer: C. Reduced statistical power. Rationale: a small sample size in research can reduce the study's statistical power, making it less likely to detect significant effects or differences between groups. This can limit the study's ability to draw meaningful conclusions and may result in a failure to detect important relationships or effects that exist in the population. Question 12. A nurse is participating in a research study that involves experimental manipulation of a variable to determine its effect on patient outcomes. What type of research design is most likely being used in the study? A. Descriptive research. B. Cross-sectional research. C. Correlational research. D. Experimental research. Answer: D. Experimental research. Rationale. Experimental research involves the manipulation of an independent variable to observe its effects on a dependent variable. This design allows researchers to establish cause and effect relationships by controlling for potential confounding variables and randomly assigning participants to treatment groups. Question 13. A nurse is conducting a research study that involves the collection of data from a large population. Which sampling method would be most appropriate for this study? A. Stratified sampling. B. Convenience sampling. C. Snowball sampling. D. Quota sampling. Answer: A. Stratified sampling. Rationale. Stratified sampling involves dividing a population into subgroups strata based on certain characteristics and then randomly selecting samples from each stratum. This method ensures that each subgroup is adequately represented in the sample, making it suitable for studies involving large and diverse populations. Question 14. A nurse is reviewing a research article and finds that the study used a double-blind design. What does this design involve? A. Both the participants and the researchers are unaware of the treatment assignments. B. Only the participants are unaware of the treatment assignments. C. Only the researchers are unaware of the treatment assignments. D. Neither the participants nor the researchers are involved in the study. Answer: A. Both the participants and the researchers are unaware of the treatment assignments. Rationale. A double-blind design is one in which both the participants and the researchers are unaware blind of the treatment assignments. This helps eliminate bias and ensures that neither the participants nor the researchers can influence the study outcomes based on their knowledge of the treatment. Double-blind designs are commonly used in clinical trials and experiments to maintain objectivity and reduce potential sources of bias. Question 15. A nurse is conducting a research study to investigate the prevalence of a rare genetic disorder in a specific population. Which sampling method would be most appropriate for this study? A. Random sampling. B. Convenience sampling. C. Purposive sampling. D. Snowball sampling. Answer: A. Random sampling. Rationale. Random sampling is the most appropriate method for investigating the prevalence of a rare condition in a specific population, because it ensures that each member of the population has an equal chance of being included in the study. This helps minimize selection bias and allows for more accurate estimation of prevalence rates. Question 16. A nurse is conducting a research study on the effectiveness of a new pain management technique for patients with chronic pain. What is the role of the control group in this study? A. To receive the experimental treatment. B. To provide baseline data for comparison. C. To administer the pain management technique. D. To assess the long-term effects of the treatment. Answer: B. To provide baseline data for comparison. Rationale. The control group in a research study serves as a reference or comparison group. In this case, the control group provides baseline data for comparison with the experimental group, which receives the new pain management technique. This comparison helps determine the effectiveness of the new technique by assessing whether it produces better outcomes than standard care or no treatment. Question 17. A nurse is conducting a research study on the impact of a new medication on blood glucose levels in diabetic patients. The nurse randomly assigns participants to either the medication group or the placebo group. What is the purpose of random assignment in this study? A. To ensure that all participants receive the new medication. B. To reduce the risk of selection bias. C. To allow participants to choose their treatment group. D. To increase the likelihood of a placebo effect. Answer: B. To reduce the risk of selection bias. Rationale. Random assignment in a research study helps reduce the risk of selection bias by ensuring that Participants are assigned to treatment groups in a random and unbiased manner. This helps ensure that the two groups are comparable at the start of the study, making it easier to attribute any differences in outcomes to the treatment being investigated. Question 18. A nurse is reviewing a research article and finds that the study's 95% confidence interval for a mean laboratory value is from 85 to 90. What does this confidence interval indicate? There is a 95% chance that the true mean is between 85 and 90. B. The study results are not statistically significant. C. The true mean is exactly 87. 5. D. The study had a small sample size. Answer. There is a 95% chance that the true mean is between 85 and 90. Rationale. A 95% confidence interval indicates that there is a 95% probability that the true population mean falls within the range of 85 to 90. It does not imply that the true mean is exactly 87.5, but rather that it is likely to be within that interval. This provides a level of confidence in the precision of the estimate. Question 19. A nurse is conducting a research study on patient satisfaction with a new telehealth program. Which type of data would be most appropriate to collect for this study? A. Blood pressure readings. B. Qualitative interview responses. C. Numerical satisfaction scores. D. Observations of patient behaviors. Answer. C. Numerical satisfaction scores. Rationale. Collecting numerical satisfaction scores is the most appropriate method for quantifying patient satisfaction with the telehealth program. This data can be analyzed statistically and provides a quantitative measure of patient satisfaction, making it easier to draw conclusions and compare results. Question 20. A nurse is conducting a research study to explore the impact of a new nursing intervention on patient anxiety levels before surgery. The nurse collects data from a sample of 100 patients who underwent the intervention. Which term best describes this sample of 100 patients? A. Population. B. Convenience sample. C. Stratified sample. D. Sample size. Answer. D. Sample size. Rationale. In this scenario, the term sample size refers to the number of participants, 100 patients included in the study. The sample size represents the subset of the population, the larger group of patients who could potentially undergo the intervention that was selected for the research study. Don't forget to hit that subscribe button and ring that notification bell so you never miss out on our informative and fun content